My name is Teresa. I'll be the nurse for today. And what's your name, sir?
Terry.
Hi, Terry. How old are you, Mr. Terry?
I'm 62.
Okay, very good. Well, Mr. Terry, you're here today for your cardiac exam. So I'll be palpating and listening to your cardiac valves, and there'll be several times I'll listen to the same ones. Doesn't mean anything's wrong, just means that we're going to get a good assessment, okay?
Yes, ma'am.
All right, if you have any questions, please let me know.
Okay.
Okay, so the first thing we're going to do is we're going to palpate the carotid arteries one at a time. Okay, we never want to palpate more than one at a time because we don't want to have an obstruction of your blood flow to your brain. Okay? Okay, excellent. So the next thing I'm going to do is I'm going to listen to them with my stethoscope. On the bell side, which is the small side, it helps you hear different sounds. Okay? Oh, what I want to ask you to do is take in a deep breath, blow it out, and then hold your breath. Okay, go ahead. Let's try that again. Now, just look straight ahead. It's fine. Okay, excellent. Okay, go ahead and breathe. There you go. We'll do the same thing on this side. And listen back up again. Okay. Okay, excellent. All right, very good. Now I'm going to go ahead and listen to each one of your heart valves, and I'll identify and name each one for us, okay?
Okay.
All right. First thing we'll do is I'm going to listen to them with the large stethoscope, and we're going to listen to the aortic, which is your right second intercostal space. It's aortic. Very good. Second intercostal space, left pulmonic. Okay. Third intercostal space, center sternal border, is the Erb's point. Excellent. Fourth intercostal space on the inner left sternal border is your trabecular. Okay. And fifth intercostal space is your mitral valve, center midclavicular line. Excellent. Okay, we're going to do that one more time with the bell. Okay. Aortic, pulmonic, Erb's point, trabecular, and mitral valve. Okay, very good. Now if I just get you to lay down for me for just a moment, we're going to do the same thing, just we're going to do it laying down. Okay, and we are also going to assess your pericardium, which is where the center of your heart valves are located at, for any irritation, okay? And that looks to be just fine. So we're going to assess your carotid arteries for any pulmonary distension. If you can turn your head to the left, to your right. Okay, very good. I don't see any distension there. Okay, if I can get you to turn your head this other way for me. That looks very good. Okay, excellent. So now I'm going to auscultate, or I'm going to palpate, and we'll feel each area again, and then we'll listen to them with the auscultation. So aortic, pulmonic, Erb's point, trabecular, mitral valve. Okay, now we're going to listen to them. Aortic, pulmonic, Erb's point, trabecular, mitral valve. Okay, now I'm going to listen to it one more time with the bell.
Mm-hmm.
Aortic, pulmonic. Can you see me in there? Herbs point. Trabecular. Mitral valve. Excellent. Now if I can just get you to roll over and turn on the left side for a moment for me, I'm going to listen to your mitral valve as it gets closer to your chest cavity. Excellent. And while we're here, hold on. Okay. I'm going to palpate it. That is your apical pulse. Okay, then roll back over for me. And I'm going to palpate your apical pulse while we're here. That's your mitral valve. Excellent. Okay, all right, Mr. Terry. That would conclude our cardiac exam for today, okay? Now I look forward to having you back in for our abdominal.
Yes, ma'am.
Thank you so
You're
much.
welcome.
Okay. Okay, so I'm going to give a report for a 32-year-old male, 62-year-old male for a cardiac assessment. Today, we listened to his carotid arteries on both right and left side of his carotid arteries. We palpated each point, and I listened to each point with the bell side of the stethoscope. It was negative for any bruise and negative for any murmurs. We also moved on down to the heart valves. I listened to all 5 points. I listened to the aortic, pulmonic, Erb's point, trabecular, and the mitral valve with both the diaphragm and the bell, both sitting and lying down. And he was very good auscultation. I noted no heart murmurs. I did have S1, S2 with no S3 and no S4 noted. We also assessed jugular distension, vein distension on both sides of the carotid artery. Both were negative for jugular vein distension. His pericardium was negative for irritation, and we palpated his apical pulse, and it was a steady apical pulse with no irregularities noted. That should conclude. Also we did do all 5 points, both sitting up and lying down position with both sides of the diaphragm, with both sides of the stethoscope. And that should conclude our cardiac assessment for our 62-year-old male. Thank you. By TMcDonald.